Fam Good Luck right here. Welcome to my channel. If you've not subscribed yet, please subscribe. Yeah, let's grow up this channel. Thank you. So, my first presentation, or my first health talk, is going to be on male infertility. That sounds well. Most times when a couple, when they are unable to conceive, most at times the failure is being attributed to the female counterpart neglecting the male counterpart. Well, this is 21st century, and I figured that, oh wow, we actually need to know more about fertility, about conception. So it doesn't just lie on the side of the lady, the male too is involved as much as the lady. So stay tuned. So let's dive right in. What is male fertility? Male fertility is the ability of a male to impregnate a female partner successfully. And of course, there are several factors that can result to this. That's the sperm quality and the quantity. Now, this is primarily determined by the sperm quality and quantity. Next, there are several factors that can actually affect male fertility. These include lifestyle, genetics, environmental factors, and underlying medical conditions. Now, let's look at the issues that can affect male fertility. One is what we call varicocele. Varicocele is the abnormal enlargement of the veins in the scrotum, and this can lead to poor sperm production or poor sperm quality. Next is hormonal imbalance. Are you confused? Yes, hormonal imbalance also occurs in male, not just in female. And yes, when there are when certain hormones in the male reproductive organ is not balanced. What I mean by non balanced, it means that it is not at the level that it should be, or if it's at a greater level that it should be. For example, the luteinizing hormones, the follicle stimulating hormones, the thyroid hormones, the testosterone, those are necessary hormones that are involved in male fertility. And when there is an imbalance in these hormones, it will surely affect the sperm production and the overall quality of the sperm. Next is the STIs. That is what? Sexually transmitted infections. For example, chlamydia, gonorrhea. Not all diseases are sexually transmitted. So, but for the sexually transmitted infections like the two I mentioned, they can actually cause scarring in the male reproductive tract, and this can lead to fertility issues. Next is genetic factors. Of course, the genes are made up of what? Chromosomes. We have 46 chromosomes in a healthy human being. So that is 23 from your father and 23 from your mother. So now, for the male, when there's an abnormality in a particular chromosome, it can actually lead to infertility in male. Now, aside the issues I listed that can affect the male fertility, there are also lifestyle factors that can affect the male fertility. One is obesity. Now, what is obesity? Obesity, does it just really mean someone being fat? Now, obesity means when your body mass index is greater than or equal to 30. How do you calculate your body mass index? You weigh yourself on a scale in kilogram, then you also check your height in meter. For the height that is in meter, you multiply it by that same number. That is, you square it. Now, when you've done that, you get that your weight and divide it by that your height that you squared in meters. By that, you know your body mass index. Now, if your body mass index is greater than or equal to 30, then that is a risk factor for male fertility, because that is obesity. Next is your tight underwears. The guys that want to get tight underwears. I mean, it doesn't even give comfort. So why go for it? The tight underwears you're wearing can actually lead to low sperm count. Next is smoking and alcohol consumption. A lot of health, defects has actually been said about smoking and of course alcohol overconsumption. But people still go ahead doing it, due to addictions and peer pressure and all of that. Now let me bring it to you that smoking and overconsumption of alcohol can actually lead to decreased motility of the sperm. And you know what it means when the sperm is unable to meet the egg for fertilization, and in that case it can lead to infertility. Next is placing gadgets like your laptops, your cell phones on the at your laps, like the location of your groin. Yes, it can actually result to poor sperm production and also motility. This particular point, of course, is something we usually say almost all the time, and that is what drug and steroid misuse. Yeah, like you get to see lots of people walk into the pharmacy and they'll be like, okay, my doctor prescribed this drug for me, it's finished and I want a refill. Why do you want a refill? Do you even know if you need it? Oh God, please save me the long talk and know what to do. You shouldn't want a refill except and only if your doctor recommends that you continue the prescription, because there are actually side effects that comes with prolonged use of drugs. Now one of them is your fertility problems. You get to see that you are beginning to have fertility problems due to the drugs that you have been taking for a long time. There are several drugs. You have your proton pump inhibitors like cimetidine. There are actually lots of drugs that can lead to fertility problems, like trying to give you stuff like erectile dysfunction. That is a situation whereby you have poor erection because a situation whereby you have poor erection due to low blood flow to your penile organ. So please cut off the drug misuse and steroids. Of course, steroids can do lots of harm than good. Even for those that take it like anabolic steroids, people that take it for build up, please cut off all of that if you really want to father a child. Now let's move to the pathophysiology of male infertility. One is the pretesticular factors. Pretesticular factors, just like the name before testicular factors, they are just factors that affect the production of the hormones. That is factors that can lead to hormonal imbalance due to either hypopituitary diseases in the brain. Yeah, so next is testicular factors. Okay, now you have the hormones down there, but now there are diseases that are affecting the hormones, like proper action or function or flow of the hormones. For example, some of the factors that can be found in this testicular stage is the varicocele. That is when the veins in the scrotum are being enlarged. It will prevent it will delay the flow of those hormones that have been produced. And this can also contribute to erectile dysfunction. Now next is the post-testicular factors. Now you have the hormones, they have been produced in the adequate amount, but now there are blockages in sperm pathways, and this can be due to congenital abnormalities or scarrings from infections. Remember when I mentioned STI infections causing scarring in the reproductive organ of the male. So now this can lead to that can be post-testicular factors affecting sperm, male infertility. Now, next is the genetic factors. Genetic factors like cystic fibrosis or genetic abnormalities. That is when there is, an abnormality in a chromosome or genetic mutation in the male. It can actually affect the sperm production and function. Now, how can male infertility be diagnosed? This involves a comprehensive evaluation that takes into account lots of factors. One is medical history. Now, the healthcare provider involved will ask you questions regarding your medical history, and this includes the past illnesses that you may have suffered from, the drugs that you may have been on, your sexual life, if you experience premature ejaculation or erectile dysfunction, and how long you have been trying to conceive. Next is the physical examination. The healthcare provider may want to examine the overall reproductive health of the individual concerned, and this includes palpation of the testes to check for conditions like varicocele, the size and the consistency. Next is semen analysis. Now, this is a fundamental test to check for male fertility. It involves collection of the semen either through masturbation in the lab, because there is a duration to which you need to get the semen and conduct the semen analysis. Anything beyond that duration, you may get a false positive or a false negative result. So semen analysis should be conducted to check the sperm count, the morphology, the viscosity, the motility, and the overall analysis of the sperm. Then also, you may be subject to some additional tests like hormonal assays and genetic testing, imaging study, post-ejaculatory analysis, and testicular biopsy. So now we've talked about what male fertility is and how to diagnose infertility in male. Now, what is the way forward? Congratulations to science, because there has been lots of approaches that have been devised to address male infertility. Now, first of all, I'll take us through the approaches that you yourself can handle on your own before I'll take you through the approaches that requires the supervision of a healthcare provider. One, for the approaches that you can handle on your own, one is healthy diet and lifestyle. Now, maintaining a healthy diet rich in fruits, vegetables, lean proteins, and healthy fats can actually contribute to the overall sperm production. Also, avoidance of alcohol, smoking can have beneficial effects on sperm motility and overall quality of the sperm. Exposure to environmental toxins cannot be left behind. For those of us that are working in plants, gas plants, things that actually expose us to toxins like carbon monoxide and radicals like lead, arsenic poisoning, and all of those heavy free radicals actually affects the sperm production and motility. Next is optimizing sexual health. As a couple, next is optimizing sexual health. As married couple, maintaining regular sexual activity can help in sperm production by reducing DNA depletion of the sperm and also promoting sperm turnover. However, there is a warning to this. You have to try as much as possible to avoid ejaculating repetitively, as this can affect the quality of the sperm. Next is regular physical activity. Of course, we've heard a lot about the positive and the health benefits of exercising. Yes, those are true. It also boils down to the fertility. It helps manage the stress and helps relax the nerves and helps improve blood flow to the reproductive organ, thereby promoting sperm production and motility. But then you should be moderate in your exercise, because intense exercise can also be dangerous or harmful to the sperm production. Next is stress management. I mean, stress has lots of negative impacts ranging from the skin to the reproduction, that is fertility. Excessive stress can actually have negative impact in the sexual hormones, the sperm production, the motility, and the quality. Practicing stress reducing techniques can help a lot, and these include meditating, yoga, deep breathing exercises. This can actually help alleviate stress and help improve fertility. Next is the male fertility supplements and the medications used in treating male infertility. Now, I'm going to put up a warning to this. It is not everyone that will need the supplement I'm about to list. So before you go ahead to take a particular supplement, make sure you consult your healthcare professional. Now, let's dive into the supplement. Yay! We have the zinc. Now, this helps in male fertility by promoting the testosterone level, and of course testosterone is the oh my god. Now let's talk about the importance of supplements in male fertility. Supplements plays the role of improving male fertility by addressing nutritional deficiencies, supporting sperm production, enhancing sperm quality, and the overall reproductive health of man. Now, for these supplements, you may not need some particular supplement. So you make sure that you seek the advice of a healthcare professional that will tailor your need of supplements. We have the zinc, we have the vitamin D, we have the vitamin C, we have the coenzyme 10, we have the ashwagandha, we have the milo-inositol, we have the L-carnitine, we have the vitamin B12, we have the vitamin B9 or folate or folic acid, we have the yohimbe, we have the honey goatweed, we have the maca root, and lastly we have the Tribulus terrestris. But remember, like I said, you may or may not need certain of these supplements. That you're finding difficult to conceive doesn't mean that you should go to the market and purchase all that I just listed. No, this is solely from your healthcare professional directives. And remember that these supplements need to be taken at a particular dosage to ensure the optimal performance and the optimum effect to the reproductive health. Now, aside the supplements, we also have the hormonal drugs or hormonal medications that can help with the hormonal imbalance. And of course, hormonal imbalance is a major factor to male fertility. One, we have the clomiphene citrate. This is an estrogen blocker, and by being an estrogen blocker, it triggers the pituitary gland to make more luteinizing hormone and follicle stimulating hormone, and these hormones helps in the sperm count, motility, and morphology. Now, for the dosage, is usually taking 50 milligram, taken 3 times in a week. For example, can take on Monday, Wednesday, and then Friday. You get my point? Yeah, that is 3 times in a week, and this can be taken for a minimum of 3 months, up to 6 months, and yeah, till you get your desired effects. So what this drug does that is that it helps reduce. So what this drug basically does is that it helps reduce symptoms of hypoandrogenism, that is low testosterone. It also increases sperm counts and potentially help improve non-obstructive azoospermia. Yeah, that sounds like a big word. It's actually a condition whereby there's an obstruction that prevents the sperm from meeting the semen. Next is the human chorionic gonadotrophin, that is the HCG. This is a hormonal treatment that can be used to improve testosterone level in men with hypoandrogenism, that is low testosterone. It's usually a last resort because it requires 2 to 3 injections per week. HCG works directly by stimulating the testes to make its own testosterone and improve sperm production. Next is anastrozole. This is actually developed for women with breast cancers that are estrogen sensitive. So it works by inhibiting the enzyme aromatase, thus prevents excess testosterone from converting to estradiol in the body tissues. It is typically used when estradiol is higher and testosterone is lower after correcting initially the hormonal imbalance. Anastrozole can improve sperm production, including sperm motility and morphology. Anastrozole has been found to reduce male hypoandrogenism, that is low testosterone, such as low energy, reduced muscle mass, low libido, and erectile dysfunction. The dose is usually 0.25 to 1 milligram every day or every other day, depending on the drug response to the individual. Next is mesterolone. This is actually used to replace testosterone in male with hypogonadism. Hypogonadism is a condition where the male is unable to produce sufficient testosterone on its own. It's usually dosed 25 to 50 milligram 2 to 3 times a day for 90 days. Next is letrozole. This helps restore normal testosterone level in men with obese-related hypogonadism. The dose is usually 2.5 milligram once weekly for 3 to 6 months. Next is bromocriptine. Infertility due to hyperprolactinemia, that is production of breast milk from the breast of male, can be treated with this drug. The drug helps prevent or stop the production of prolactin from the pituitary gland. This medication is best for men who have abnormal sperm counts with hyperprolactinemia. The dose is usually 5 to 10 milligram daily for a period of about 4 weeks. Now, if your doctor has taken you through the above processes mentioned, yet no positive result, you've not been able to impregnate your partner, that is not the end of the road. There are other means, and that is what we call assisted reproduction. I won't go into details in this assisted reproductive technology, but I'm just going to list the 3 major types. One is intrauterine insemination. 2 is in vitro fertilization. 3 is intracystoplasmic sperm injection. So that comes to the end of my lecture. In conclusion, male fertility can be attributed to several factors ranging from lifestyle to diet to environmental factors to hormonal imbalances to genetic factors and of course underlying medical conditions. Therefore, optimizing sexual health, seeking counseling and support further enhances male fertility. Alright, that is the end of this lecture. I hope you really enjoyed it as much as I did teaching it. If you have questions, you can put it down on the comment section. I will create a video where I'll be answering those questions. Bye.